Hello guys, I am Dr. Robot. Today we are going to discuss an interesting topic, cardiac failure or congestive heart failure. I am sure that you know what is heart failure. Anyway, before entering into the topic, I am going to give a small introduction. Congestive heart failure describes a condition where the heart muscle is weakened and cannot pump as strongly as before. A state in which the heart cannot provide sufficient cardiac output to satisfy the metabolic needs of the body. It is commonly termed congestive heart failure since symptoms of increased venous pressure are often prominent. This image indicates a number of population, men and women, who is affected with congestive heart failure in different age groups. The causes of heart failure is divided into three groups. 1. Impaired cardiac function. 2. Increased cardiac workload. And 3. Acute non-cardiac conditions. The impaired cardiac function include coronary heart disease, cardiomyopathies, rheumatic fever, endocarditis. The increased cardiac workload includes hypertension, valvular disorders, anemias, congenital heart defects, and the acute non-cardiac conditions include volume overload, hyperthyroid, fever infection. Do you know who is more prone to heart failure? The risk factors is divided into two. 1. Primary risk factors. 2. Contributing risk factors. The primary risk factors include coronary artery disease, advancing age. The contributing risk factors include hypertension, diabetes, tobacco use, obesity, high serum cholesterol, African American descent, valvular heart disease, and hyperolemia. The disorder of coronary arteries, high blood pressure, cardiomyopathy, abnormal heart rhythm, heart valve disorder also leads to heart failure. The mechanism of clinical manifestations resulting from heart failure can be explained on the basis of mutually interdependent backward and forward failure. The backward heart failure. According to this concept, either of the ventricles fails to eject blood normally, resulting in rise of end diastolic volume in the ventricle and increase in volume and pressure in the atrium, which is transmitted backward, producing elevated pressure in the veins. The forward heart failure. According to this hypothesis, clinical manifestations result directly from failure of the heart to pump blood, causing diminished flow of blood to the tissues, especially diminished renal perfusion and activation of renin-angiotensin-aldosterone system. Heart failure symptoms are traditionally divided into left and right-sided, recognizing that the left and right ventricles of the heart supply different portions of the circulation. However, people commonly have both sets of signs and symptoms. The symptoms of left side congestive heart failure includes fatigue, orthopnea, restlessness, cyanosis, extreme weakness, dyspnea. And the symptoms of right side heart failure includes bloating, anorexia, cyanosis, oliguria, nausea, edema, and distended neck veins. The following laboratory tests are done in case of cardiac failure: blood test, chest X-ray, electrocardiogram, echocardiogram, stress test, cardiac computerized tomography or CT scan, magnetic resonance imaging MRI, coronary angiogram, and myocardial biopsy. The drugs used in cardiac failure may include the diuretics, loop diuretic like furosemide, thiazide diuretic like hydrochlorothiazide, angiotensin converting enzyme inhibitors like enalapril, lisinopril, captopril, angiotensin receptor blockers like losartan, telmisartan, beta blockers like bisoprolol, carvedilol, metoprolol, vasodilators like hydralazine, drugs which increase cardiac contractility, cardiac glycosides digoxin, beta agonist dobutamine, bipyridines, milrinone. And finally, the preventive measures. The 5 ways to prevent heart diseases. 1. Nutrition. Adults should eat more plant-based foods such as vegetables, fruits, nuts, legumes, and whole grains. Minimize processed meat and sweetened drinks. 2. Exercise. Each week, adults should engage in at least 150 minutes of a moderate intensity activity such as brisk walking or at least 75 minutes of vigorous activity such as jogging. 3. Tobacco. At each healthcare visit, tell your doctor whether you have smoked any tobacco product in the previous month, and if so, work with your doctor to create a plan to quit. 4. Social determinants. Talk to your doctor about factors that affect your health such as housing, food security, transportation, self-image and culture. And 5. Aspirin. Because of the risk of bleeding, don't take aspirin for prevention. Thank you guys. See you in another video. If you find it easy to understand our lessons, please do like, share and subscribe to our channel, Dr. Medicine. Thank you.